I want to thank Senator from California and the many senators who stood up proudly to fight for a woman's right to make her own health care decisions. Certainly in this year of 2012, after decades of fighting to make sure that women have the rights and opportunities to be whoever they want and to make their own health care choices, this vote today is an affirmation of that if we can beat back this blunt amendment. We are at a very serious time in our nation's history. Our economy is struggling. We are getting back on track. Millions of families get up every day and are concerned about whether they can afford their mortgage or send their kids to college. I have to tell you, millions of women in this country did not think they would have to get up this morning and worry about whether or not contraception would be available to them, depending on who their employer was. Mr. President, this is a serious issue. We've heard a lot of rhetoric about what the blunt amendment is. My colleague from California just described it to you. It is terrible policy. It will allow any employer in America to cut off any preventive care for any religious or moral reason. It would simply give every boss in America the right to make the health care decisions for their workers and their families. It is a radical assault on the comprehensive preventive health care coverage that we have fought so hard to make sure that women and men and families across this country have. If this amendment were to pass, employers could cut off coverage for children's immunizations if they object to that. They could cut off prenatal care for children born to unmarried parents if they object to that. Mr. President, the American people are watching today. Young women are watching today. Is the United States Senate a place where their voice will be heard and their rights will be stood up for? We have watched this assault on women's health care for more than a year now. When a year ago, almost at this time to this day, we were working to make sure we kept the government open by putting together our budget agreement. In the middle of the night, all the numbers were decided. All the issues were decided. We were ready to move forward within hours to make sure that our government did not shut down. What was the last issue between us and the doors of this government closing? The funding for Planned Parenthood. I was the only woman in the room. And I stood up with those men and I said, no, we will not give away the funding for this over this budget. And the women of the Senate the next morning stood tall. We gathered all of our colleagues together. We fought back. We won that battle. But those who are trying to take away the rights of women and to make their own health care choices and to have access to contraception in this country today have been at it every day since. We are not going to allow a panel of men in the House to make the decisions for women in this country about their health care choices. We're not going to allow the blunt amendment that is before us today to take away that right. We believe that this is an important day. And in fact, Mr. President, this happens to be March 1st. It is the beginning of Women's History Month in this country. Let us stand tall today in this moment of history and say the United States Senate will not allow to let women's health care choices to be taken away from them. Mr. President, I urge my colleagues to vote with us to table the blunt amendment and to tell women in this country everywhere that we stand with them in the privacy of their own homes to make their own health care choices.